This is how I resolved pain, often in one visit, just by taking good care of the muscles that move the joints. This is about your wrist and your forearm. And there is a ton of muscles going through the forearm. Most of them attach to this big bump here or here, but there's muscles that attach right to the shaft of the bone. So we have to go down the whole bone looking for tender spots. Think of this as a bone massage. It's not a muscle massage. We're pushing into the bone at each of these points. So we'll start up at the medial epicondyle, they call this bump on the inside of the elbow. There's 5, 6 muscles that attach in here. For example, this one attaches over here and pulls your hand like this. But they're all really close together, so we're just going to have to go around that whole bump there. So we'll start at the top and work our way around. This is a little challenging to your fingers because you do have to push into the bone, and especially when you get into more meaty areas with more muscle, you got to push in a little bit. And when you find that tenderness, spend a minute massaging, and then we pull up or pull down on the ankle to release the tension of injury, which is universal. Whether it's your elbow, we tend to tighten up. And then we just keep going around. Take your time with this. I would spend an hour with patients testing their muscles, and anywhere there was weakness or pain, I would work through like this and then give them a little pull, find another spot, and I'd make sure that I went all the way around that bump. And then the shaft of this bone, we have to go most of the way down. So we'll start right there, and right off the bat, pushing in right there, I feel some tenderness. You're going to feel so much better cleaning these things up. Rub for a minute, pull, and then keep going. You want to push down into the bone as best you can, wherever there's tenderness. The more tenderness you find, the better the outcome's going to be. So dig, and then stretch. And then we're going to go over to the next bone. We're just going to work our way down. So this side is your radius. There's muscles that attach to the front surface, a little bit off to the side, and then also right on the side of that bone. So we'll just go down the front first. Find a tender spot. Massage for a minute. Really push in to the soreness. I would push until people cringed and I'd back off a little bit. And then stretch. And then anterior lateral side. This is the muscle that pulls our arm over. If we're doing muscle testing, there's flexion. So we can push on the pinky side and then push on the thumb side. There's extension. Push on the index finger side. Push on the pinky side. You'll get a little different muscles pushing that way versus that way. There's straight abduction, so we can pull our hand back this way. And we're just seeing if it hurts or if it feels weak. And then adduction, push across this way. There are muscles that go right to the fingertips, so you can do finger flexion and finger extension, but they all come to the same areas. So, and then there's pronation, supination. Pronation, supination. We can hold it tight and try to apply that pressure and then try to push back. And we're just seeing if it feels weak or pain. It's actually probably easier if you just grab onto a table, turn one way, and then turn the other way. I'm trying to turn it this way or turn this way. I'm trying to go like this. That'll give you a little bit more indication where the pain is too. So we'll go to the anterior lateral radius, dig into that bone. And these are muscles that are used a lot. So you're going to find a lot of tenderness, whether you have a chronic pain or not. Stretch. This one actually comes back here. We'll go ahead and hit this while we're on this side. And there's discomfort there. Side of the bone there, dig in, minute, stretch. And then the lower quarter of both of those bones we want to check. Again, just don't rub over it. You got to push into the bone and find that. You have to be like Dr. Stone. I would dig until I figured it out, and people would walk out sometimes very amazed because they'd had the pain so long. And this is all I was doing. I would also treat inflammation and stress with our medicines, and I would do other points to support that. But as far as my shoulder hurts, my elbow hurts, my wrist hurts, this is what resolved the pain. This is the radius bone. Dig in. Pull over here, push in, pull, and then the metacarpal, so those are the bones in here that are movable, but they're tied together with our palm. We'll just go across. This one attaches to that sheet, so we want to kind of check the whole palm. Here, here. This one was a little more tender. Spend some time on it and pull. And then this bump over here, go around that whole bump, find the tenderness, massage and pull, and we'll get up into the palm. So this finger, this is the metacarpal, comes down right here. I definitely found a real sore one right in there, but just check through the whole palm, cleaning up. Found something else, massage, pull, and then you can see it kind of comes up in and flexes the fingers. So get right on that bump and then go off to the sides too. Find the tender spot, massage, pull, and then just keep going. There's attachment here and here, so we got to do them both. Bump, to the side, bump, to the side, sore, massage, pull. And you just go through all the fingers that way. And then we'll go over to the lateral epicondyle. And again, these muscles actually go up and attach right into the humerus, it's called, our upper arm bone. So push into that bone. And when you get on the bone, yikes. I don't have any pain in this arm, but wow, that's tender. Massage, pull. And we just work our way down, go all around the hard bony spots, all the way around. And then it comes down that bone. So you'll feel little crevices, cracks, holes, and you kind of poke into those, but you're really trying to put pressure onto the bone. And right there I can find a real tender spot. And I can tell like that one, when I work it out, everything's going to work better in this arm. Massage, pull, and then there's several muscles that attach to the shaft of the ulna is that one that comes down here. You can feel that one go all the way to this bone, and the radius kind of sits up in here, so it's small on this end and bigger on this end. They're attached to these bones and all the tissues in between, so you want to just kind of start down here and push in between and onto the bone. In between and then onto the bone. In between, onto the bone. Again, pain-free on this arm, and I'm still finding spots. That's on the back of the radius there, pretty tender when I find that. Massage for a minute, that's going to make a difference. That's probably the worst one so far. And pull. We'll just keep going down. Take as much time as you need to find these spots. Feel the bones in your body. And then you can see the attachment into the metacarpals. That's these bones in the palm. So dig around there, push into like the divots, the holes you can feel, and try to get right on the bone. And a lot of times in those holes you'll find a little bit. And then this one pulls your thumb back this way, right at the base of that bone. That one's a little sore. Massage, pull, and then the next one here. Kind of get on the back also, but it attaches, it pulls your thumb that direction. So it's a little bit more on that side. Massage, pull, and same thing, all these knuckles. Bonus, Korean hand massage, they affect all organs and all systems through the hands. So, and I just say bonus because they suggest that it has wide-acting effects. Get into that knob right there, and then off to the sides. And that one right there, feel a little tenderness. Massage for a minute, and pull. And then the next one, and I won't go through them all, but so there's a lot of connections there to check, but just follow the video on both arms. Pause it when you find a real tender spot and work on it. Stretch, hit play again, and go on to the next one. And you will have considerably better feeling and functioning elbows, forearms, and wrists.